because of an ongoing shortage of IV bags. You might get less fluid. Across Nevada, some people had elective surgeries or procedures delayed. One clinic explains how it adapted for cancer patients. Another clinic that was desperate for help says, thanks to Fox 5, people can now get their surgeries.
Nevada, he was one of the best doctors. He said he could help me.
Pete Sandoval needed surgery here. Desert Cardiovascular Consultants. Patients may have congestive heart failure, pulmonary hypertension, vascular disease, or swelling of the limbs. Pete had pain walking. Recently, he says his elective, non-urgent surgery had to be delayed until the clinic could get more saline bags. Weeks ago, Hurricane Helene struck a North Carolina Baxter plant that makes most of the nation's supply. New orders are still being rationed.
I didn't really like it because I wanted to get it done.
We were pretty desperate for IV fluids. After Fox 5's program that aired that night, we were getting blown away with phone calls and with offers. And then as far away as New Jersey and New York, we had some offers internationally.
Dr. Zia Khan's office got help after going on social media and Fox 5. Does anyone have spare saline bags? So many supplies came in, Pete's surgery was back on schedule. Others could get theirs too.
And after he started the procedures, I started feeling better.
It definitely is life-saving treatment. We're very fortunate we did not have to delay anybody because of the saline shortage. We did have to modify their treatments.
Oncologist Dr. Rupesh Parikh says patients at comprehensive cancer centers critically need saline for procedures like chemotherapy and radiation. Right after the hurricane struck, he says the team for the 7 locations immediately ordered enough supplies. They even shared with hospitals and clinics in need. But nurses and staff had to educate patients on changes that do not impact treatment.
They came in for their treatments. They looked up at their pulse and say, oh, that's not enough fluid, or that's not what I usually get. And that's where our nurses really came into play. They did a lot of teaching, the same medicine, it's the same drug, just in a less concentration of fluid.
Now, from the comprehensive cancer centers to many other hospitals, doctors may have patients take medicine by mouth only if they can to conserve the saline. Supplies are expected to finally stabilize in January.